Genuinely don't think nursing school prepares you for the NCLEX, babes. What they also don't mention is that just getting your ATT after you graduate is going to take a while. You have to wait for your transcripts to be finalized. Then you have to wait for your transcripts to be sent to that nursing board to prove that you actually graduated nursing school. Then you have to wait for them to review all of that. Sometimes that takes 4 to 6 to 8 to 10 weeks. It takes months. You're about to take the NCLEX. Here are things that I wish somebody told me before I took the NCLEX. Let's get straight into it. Now, I think the most common thing people want to know is, what do I need to expect for this NCLEX? Is it really as horrible as everybody says? And yes, it is. This test is high pressure, high anxiety, all the things. And so what I wish somebody would have told me before taking the NCLEX is that you're expensive. All right, the NCLEX, just the test is $200, and we're not talking about the application that you have to pay for the nursing board you want to, practice in, and we're not talking about the platforms that you're going to use to study. Just the NCLEX is $200. All right, then your application for whatever nursing board or whatever, that's another $100 or $150. Then you got to pay for it. It adds up. So make sure you save some coins, at least $300 to $500 before taking this NCLEX, so that you are good and you're not stressed. I didn't even know until I was like, oh my gosh, it's that expensive. They don't tell you that. So another thing I would say when it comes to the NCLEX, if you are somebody that you have failed and you are a repeat test taker, you don't have to wait 45 days after to finally schedule your test. What I mean is, once you have failed your test, once they give you your ATT, you can go back into Pearson VUE and go ahead and schedule your test. It already generates the 45 days after your last test date. So you can go ahead and schedule it as soon as you get your ATT. You do not have to wait until 45 days and then go on Pearson VUE and then schedule the test. Like that limits the window of closer test dates to when the last test date that you took. And I know that sounds mad confusing, but I'm just going to repeat it one more time. So if you have failed the NCLEX, you have to wait 45 days to take the test again. So they're going to send you an ATT again. That time frame just depends on your nursing board. Then once they send you that ATT, you can go right into Pearson VUE and you can schedule your test date, and it will automatically generate the next testing date is 45 days after your last testing date. And so you can already select it, the testing center, the time, and have that already set to the side. And then you can just be studying, and you get a reminder closer to your test date. I think it's like either a week before your test date that your test is coming up, and then you get another one a few days before. So you do not have to wait 45 days literally after your test to then go onto the Pearson VUE website and to then schedule it. No, the moment you get your ATT, baby, go on that website and schedule that test. I hope that makes sense. And I think that clears up a lot of things, because what they also don't mention is that just getting your ATT after you graduate is going to take a while. You have to wait for your transcripts to be finalized. Then you have to wait for your transcripts to be sent to that nursing board to prove that you actually graduated nursing school. Then you have to wait for them to review all of that. Sometimes that takes 4 to 6 to 8 to 10 weeks. It takes months. And if you have a really good nursing program, it may just take 4 weeks. But I know for me, it took about 4 weeks before I got my ATT and for me to take it. So keep that in mind too. Just because you graduate nursing school does not mean, yeah, now I can go ahead and take the NCLEX. No, baby, you still gotta wait for that ATT, and that ATT can take a hot minute. And I think during that time frame, a lot of people start studying so that once they get that ATT, they can go ahead and take their NCLEX. My personality, I need a date on it. I need a time on it. So as soon as I got my ATT and I picked my date, that's when I started to study, because I just felt like I was mindlessly going to study and not have a set structure, or like, oh, I know I'm taking my test soon, and I was just going to be willy-nilly, and I don't want to, I know myself. So I think, you know yourself well. If you think that you can study before your ATT comes and then schedule your test, do you? But I personally waited for my ATT to come, then I set my test date, and then I started studying. So it works for you, baby. Our test can shut off between 85 to 150 questions, which means that you can shut off at 85 and pass, or you could fail. You can shut off at 110 and you could pass, or you could fail, and vice versa. You can get up to 150 questions, which means that you're still in the game. There's still a probability of you passing as long as you get those questions right. All right, and I think most of you guys have heard that, but what you haven't heard is that this test is adaptive, meaning that it goes based off of the answers that your peers are getting mostly correct or mostly wrong. What exactly does that mean, Eileen? This simply means that if you're getting questions that your peers are getting right, but you're getting them wrong, 9 times out of 10, you're not going to pass the NCLEX. That's what I mean by adaptive. It measures based off of what your peers are answering as well. So for example, if you got a question about something about respiratory and everybody answered put oxygen on the patient, and you selected raise the head of the bed and you got the answer right and they got it wrong, that puts you at a higher threshold for the exam. And that's just how it is on the NCLEX. It is adaptive. You start here, and if you get the question right, you're going above the average threshold, but if you're getting it wrong, you're going below the average threshold. That's how it works. Computer adaptive, which is separate from like adaptive to your peers, meaning that if you're missing questions about mental health, your test is going to keep generating more questions about mental health until you get them right. Coming from personal experience, I got so many mental health questions and I'm like, oh my gosh, this test is so hard. And it's hard for me because mental health is a weak area for me. So of course now it's going to be hard. So make sure that you have a strong foundation in all of the areas. Mental health, pediatrics, maternal, cardiac, GI, like have a strong basic foundation so that when you get those type of questions, you're prepared and you won't have to keep getting generated more of those type of questions that you're kind of struggling. Another thing that I don't tell you about the NCLEX is sometimes your results may be on hold, meaning that you've taken a test and it's been 48 hours and you don't have the quick results. That means that they're looking at your test. I went through that. I had my test on hold for 8 days, and yes, that is a long time. And what does that mean? That means that they are looking to see if maybe you took breaks a little too early. Maybe there's questions during the test that they're trying to just make sure that there were no glitches, there were no issues, things like that. And that is actually very common. A lot of people don't talk about it, but I did have my exam. My results were on hold for 8 days and I didn't know why. And I thought it was because I think I took too many breaks and I started crying during my test. So many reasons what I thought, but at the end of the day, I passed. And just be prepared that your results may be on hold longer than the 48 hours, and that is okay. I personally would not pay for the quick results. Like, we've already spent so much money paying for the NCLEX and, platforms to study on and maybe tutors and all these other things. It's not necessary in my opinion, but do what works for you. Next thing that most people don't know about the NCLEX is that you can take breaks before the allotted time, meaning they set a break for you at 85 questions. And your time does continue to run while you take these breaks, but you could take a break before 85 questions. You could take a break after 85 questions. You could take a break whenever during this exam. If you need that break, please take the break. You need to give your mind some time to just recuperate, regenerate, and get yourself regulated so that you continue to tackle this exam and you pass. Another thing most people don't know is you can bring snacks, you can bring water, you can bring things to the testing site. You just have to keep it in a designated locker, and you have to unlock that locker during your break times, and that does cut into your time for the test as well. But you are allowed to eat and drink, and anytime you go take back to the testing room, they do a hand palm and they do check your pockets and they do make sure that you have not brought anything into that testing room, because cheating is a big no-no, which we all know. We all have that common sense. And most people don't talk about during the NCLEX is that you can take the test in any state. It does not have to be the state that you live in. Let's say that you're going on a trip for the next 3 weeks and you're going to Texas. You could take your NCLEX in Texas. You could take it in any state. What is important is where you are registered, like your nursing board, the application that you sent in. Now, if you're practicing in another state, but you're taking the test in another state, for example, I live in Georgia. I took the test in Georgia, but I had my nursing application from Minnesota because that is where I intended to work and practice as a nurse. So although my nursing application and nursing board was from Minnesota, I took the test in Georgia. 2 separate states, perfectly fine. I'm registered as a nurse in Minnesota, and I'm currently working on getting my license here in Georgia. Keep that in mind. You can take it anywhere. Whatever works for you, whatever. You can change your testing date whenever. Just because you scheduled it on the Pearson VUE website is not concrete in stone. Like, if you need more time, if you want to push the date further back, you can do that at no cost to you. If you want to push it further up, you absolutely can. There's no cost to you. Of course, be mindful of trying to do it within 24 hours or 48 hours. I think they might charge. I'm not quite sure, but go on the Pearson VUE website and just double check. But 9 times out of 10, change your test date, no charge to you. To keep in mind with if you do consider to take your test in another state is the time zones, because there are different times to take the NCLEX. I think the earliest time is 8 in the morning and the latest time is 1, I believe, and the test is the test is 5 hours long. All right, so be prepared to be in there. Sometimes maybe the whole 5 hours. You just never know, which is why I suggest bringing a snack, bringing water, bringing something to help calm you down throughout the test. Another thing we don't tell you, that in the testing room, you cannot bring pencils, headphones, calculators, nothing. Like, in the actual testing room, you can't bring anything with you. But during the test, you can get noise canceling headphones or earbuds. You are given a little white board, as they say, and a marker so that you can write on it. You cannot erase it though. You have to keep whatever's on there. And then if you need a new sheet, you just raise your hand and they'll bring you a new sheet. It is critical, in my opinion, because I like to think out loud, and since you can't talk, writing out what you're thinking is so helpful on the NCLEX. So please utilize that whiteboard that they give you, because your thoughts are going to be everywhere during the NCLEX. That's going to help you regulate, recenter, and focus. Okay? Just letting you know. It is very hard. Okay? You're going to walk out and you're going to feel like you failed. I felt like I failed, but I passed. That is very normal to feel that way. It truly is. If you walk out and you feel confident, baby, my hat goes off to you, because you're probably a brainiac. So just be prepared that you're going to walk out feeling defeated, nervous, sad. You're going to be like emotions everywhere. Emotions unstable. But that is okay, because you just did one of the hardest tests in your nursing career thus far. What I'll tell you is it is okay to use all 5 hours, and if you need more time, you can get accommodations for your test. So please make sure, if you're somebody that probably struggles with test anxiety, or you've had accommodations throughout nursing school, to make sure you get your accommodations for this test. You are in a room with other people. Some of them can be taking the NCLEX, some of them can be taking other tests, because there's other professionals out there. People could be taking their GED test or like whatever other tests are out there. So you are in a room with other people. So be mindful of that. The thing that you need to be aware of during NCLEX is to arrive 35 to 50 minutes before your test. I know that sounds like, damn, that's a long time to get there. Yeah, I recommend you get there early, because you want to make sure that you have time to sign in. All right, they do a hand palm scan of you, then they take a picture of you, then they check your pockets, they check your this, they check your that, then you got to put your stuff away, and like all of that time. If you're early, you're on time pretty much. Yeah, so I just encourage you to get 35 to 50 minutes beforehand, because you don't know how traffic is going to be. You don't know the testing center is going to be. You don't know how many people are going to be there taking the test as well. And I'm not going to lie, I think because I've taken the test 3 times, by the way. I've taken a test in the morning, and that was super crowded. I took it in the afternoon, and it was not as crowded, but also it depends on your testing site. And I did change my testing site all 3 times. So also be mindful that just because you took the test in one location and maybe you didn't pass, which I hope you did, but if you didn't pass, you could take your test in another location the next time. It does not have to be the exact same place. And I do not recommend, if you are a repeat test taker, to take it in the exact same place that you took it before, because that will increase your anxiety. And I think it's really important that when you are a repeat test taker, to change your environment to reduce any sort of anxiety. Not conducive to your productivity, babes. You're gonna get triggered about how you failed the last time and how you can't fail this time and how you just change the site. And I think one of the last things I want to talk about when it comes to, if they don't tell you about the NCLEX, is you are going to need time to actually study. Like, things that you learned in nursing school are not applicable on this test, in my personal opinion. This is, when they say it's a safety test, it is, but it's also using critical thinking skills that I don't think a lot of nursing programs have taught us. You know, they teach us the textbook way. They teach us how to answer questions based off of what they are teaching us. But the NCLEX is its own world. The NCLEX is like a perfect world. You know, if you have all the resources, all the supplies, you have this and you have that, like, and sometimes that, it seems like it could be clear cut, but in reality, it's not what us nursing students are used to. And I just think that nursing school has not properly prepared nursing students for the NCLEX, and that's why we purchase, you know, like Archer, Kaplan, UWorld, Bootcamp, whatever, because how they have generated questions is how the NCLEX question styles are versus what we were doing in nursing school. Not the same thing, baby. ATI though is the closest, in my opinion, as far as platforms that ask questions similar to the NCLEX. Very vague, very dry. You're like, I don't know, it could be this or it could be that. Like, yeah. I will say that ATI is, in my opinion, the closest when it comes to NCLEX style questions. Followed up, I would say, is Archer, and I used Archer to take the NCLEX and I passed with Archer. Everybody has their own opinions, but people don't talk about what the NCLEX is. You don't need all the resources. You don't need to buy 5 different platforms to study with the NCLEX. Like, no, babes, you just need one good one. Archer. Just saying, I passed with it after failing twice with bootcamp. Just saying. And encourage you to dedicate some time to studying. I know some people out there say like, oh, I just took 2 weeks and I studied and, you know, I passed and nursing school prepared me. I genuinely don't think nursing school prepares you for the NCLEX, babes. And I genuinely think you need more than 2 weeks to pass. Some people pass by the grace of God, but that is just my personal opinion. Another thing is, do not wait too long after you have graduated to take the NCLEX. Don't wait 4 months later to start studying. You're going to forget information that you have learned, such as body systems, which that is important for the NCLEX. That I feel like nursing school should somewhat prepare you for. Also, your brain isn't still trained to like, okay, this is how I study, this is how I do things, like it was in nursing school. So information will dissipate, and so will your motivation, and so will your brain power. And so I don't recommend waiting that long. And I also suggest that you don't take it too soon. You get what I'm saying? Like, find that happy medium, whatever works for you. If you're a brainiac and you got it, baby. The NCLEX, I also talk about how I failed the NCLEX twice and I finally passed on my third attempt on my YouTube channel. I have 2 videos up already if you want to watch that, so you can get some insight to prepare you so that you do not become a repeat test taker like me, baby. I want you to pass for your first time. I promise you, you will if you watch those videos. And also on TikTok, I give a lot of tips and tricks for those of you that maybe have failed the NCLEX and you are repeat test takers and you just need a little bit of motivation, accountability, and good tips and tricks so that you pass the next time around. Once again, thank you guys for tuning into my video. I will see you for the next one, and I really hope this was helpful. And always comment down below any questions that you want me to cover.